So without wasting much time, the first talk is by Dr. Baskaran Mani. He is going to talk on evolving paradigms in angle and anterior segment imaging.
Good morning, everyone. Esteemed chairpersons, organizers, the local organizing committee, and Amit for inviting me for this talk. Thank you. The topic is on evolving paradigms in angle and anterior segment imaging. Some of the patents of the devices are owned, so that is my financial interest. We'll start with the goniophotographic techniques that there are quite a number of them now available and for easy portable um, you know uh, imaging of the angle. We have some of these gonio pen, redcam, anterior segment alignment, nidec, and some of the high resolution versions are available with the Wi-Fi. So it's like a handheld systems that are coming up. So hopefully these will kind of help us document the angle better. And with the nidec, multiple images are taken and stitched together so that the gonioscopic view is also there. Of course, there are some disadvantages in terms of visible light, which can probably constrict the pupil. So coherent light is used in most of them to avoid such issues as well. Of course, moving on to the UBM, which is mostly used in angle closure eyes and mostly used in glaucomas. Some of the newer advances are in 3D UBMs, mostly in experimental stage. And in this particular version, they are able to actually get multiple sections of it. And with deep learning, they are able to isolate the ciliary processes as well. And this is one of the experiments which they have done post CPC showing ciliary processes shrinking in size as well. Hopefully, these kind of technologies will get better with the newer semiconductors and deep learning algorithms. That I think one more talk is going to be on that, and that will be useful in our clinical application. Coming to the ASOCT, now we have so many of these versions are available, angle to angle scans. Most of us piggyback on the cornea department because they use it most of the time. And some of these newer techniques we are using to demonstrate the iridotrabecular contact in some of the patients and to see postoperative outcomes. And some of the higher resolution versions are used in mixed procedures as well to see the position of the stent and other conditions. And some research is ongoing on the aqueous outflow as well. So we have so many of these, and I do not think there is anything in particular that we can choose, but it is good to know about these things. Mostly these are like 14 to 16 millimeter angle to angle scans that are available. You can see that the anterior spectralis cassia 1, 2, and there are some newer systems like hyperparallel OCTs called Silite, MS49 ASOCT, and the Dream OCT from Aftercare, and Optopol, Optoview. All those OCTs are available, and we get a 360-degree view of this angle. And this is one such technology where the hyperparallel OCT is done, where the scanning is done across, and you can see a good unfast view also. Had the opportunity to test those two systems, and we'll be giving you some results on that. This is again the Dream OCT, where you also get an OCT angiography, and probably the superficial and deep layers are imaged in this and may be used in aqueous outflow imaging as well. This is one of the studies which we compared gonioscopy with the SSOCT system. The agreement seems to be good, and with the gonioscopy, the performance always is slightly lower because both are different technologies. And the hyperparallel OCT also had such good agreement. And subsequently, when we looked at both the hyperparallel, that is the Silite and the Cassia, both of them performed equally well compared to gonioscopy. And this anterior spectralis is exclusively an ASOCT platform, and that is separated from the spectralis for the posterior segment, and mostly used by the corneal surgeons for various biometric parameters and all, but it gives good resolution images of the angle as well as the lens, and can be used for some of the documentations that we have. When we use certain quantitative and qualitative parameters together, that algorithm gives a better output for gonioscopic angle closure. And there are some deep learning technologies that are being used to actually enhance this output and try to make it automatic. But only thing is the cost factor. And if you are in an institute and if the corneal people are using such instruments, these algorithms may be coming handy. And there are some of these indices that are available, like the ITC contact index, which can be automated nowadays. This is from the Cassia, and this is from the Anterior platform. Anterior takes just 6 images, and those are high resolution images, and automatically you can get this kind of ITC indices. One of the advantages of some of these OCTs is that you can also get the biometric value, so you can get axial length. Probably in pediatric and childhood glaucomas, to follow up these patients, it will be useful once the children are at a certain stage of cooperation. This, I think, somebody else will be talking. This is one of the studies which we did where Cirrus and Visante OCT performed well with comparison to gonioscopy. Some of the recent applications that people are looking at is to look at the Schlems canal variations, and they could see that the absence of Schlems canal with the ASOCT in juvenile glaucomas, and also the membrane across the angle can be imaged. And some of the recent presentations in this conference also show that when you have such membranes and you treat with the SLT or other procedures, the interventions can be less effective. So these are some of the research applications from which we learn how to manage our patients as well. And we also see that in the Schlems canal there are variations, and we don't know whether that can actually tell us some prognostic factors that we need to see in future. Also, there are digital enhancement available, ultra high resolution. Basically, these are more for in favor of looking at the Schlems canal and the angle, where these new mixed procedures are coming up. As you can see that is a cross-sectional view of the Schlems canal that can be done with these images. These are ultra high resolution OCTs where 1 micron resolution is seen, more for corneal procedures, but we can also see some of these nice Schlems canal in these. And some of this in vivo catheter probe OCT imaging also is coming up. Hopefully, that will give some insights into the basic nature of the Schlems canal and the collector channel flows. Coming to that, the aqueous outflow imaging paradigms are evolving actually. So, looking at the aqueous vein and episcleral vein, and this is looking at the transscleral aqueous outflow post ciliary plasty. You can see that with the high resolution ASOCT, some pockets of fluid are formed in the sclera to show that there is a transscleral aqueous pathway. Conventional pathways are being explored with intraoperatively using indocyanine green, seeing here a nice anatomy of the collector channels, etc. This is one of the hemoglobin video imaging. I found it to be interesting. It's just a photographic technique with a special filter, and you can see these aqueous veins where there is clear column in between the blood vessels, and they're able to actually quantify that also. This could be useful. They have done some work on use of rho kinase inhibitors, and also with mixed devices, seeing the aqueous outflow. This will probably tell us how these mixed devices work and whether they will stand the test of time or not in future. Some of the vasculature patterns are being explored also with the OCT angiography in research applications to look at superficial and deep layers like this. And they are able to tell whether the medications or the devices can increase the outflow or even in trabeculectomies. Of course, we know that blebs are being evaluated with these devices, and the vasculature also shows that post trab the vasculature changes with time. And I'll just quickly go through this. At 1 month, the vasculature seems to be very high, and then it starts dropping. This kind of experiments will tell us when to intervene with medications, of course. And last, the photoacoustic imaging, where the ultrasound and the OCT advantages are used together in looking at various vasculature as well. We don't know yet whether this gives more advantages than the OCT or not. And of course, the tube's position, patency, and with time, what happens to the tube, whether it comes forward and affecting the cornea, intervening at the right time. All those things are some of the applications, of course. Some of the aqueous shunts have also been looked at with these ASOCT. And recently with the KDB goniotomy, you can see this kind of wedge, and then slowly it starts becoming, flat, getting scarred. We need to see whether this has any prognostic indication as well. So ASOCT is mostly a research tool, but it has certain advantages. The multimodal OCT platforms offer a wide range of applications in anti-segment and angle evaluation. Ultra high resolution, software enhancement, and volume rendering enable newer research opportunities. Clinical applications are evolving, especially with the mixed paradigms, and more research is needed to bring it to fruition. Thank you for your attention.